So where do you see the biggest challenges for healthcare organisations to actually achieve their strategic goals?
I think in the experience that we've had in our consultancy and coaching is around the area of leadership and accountability. I think any organisation, if it's honest, it struggles in that, and particularly too, I think, with the introduction of the 10 national standards, which is essentially a foundational quality assurance process or program to ensure we're keeping patients safe. There's a lot of measures and additional systems and process changes that we've needed to introduce into our healthcare environments to ensure we're actually meeting those standards, let alone the operational objectives that are coming out of an organisation's strategic plan. So I think the key steps that we always look at working with an organisation is around, first of all, creating an objective, transparent system that enables us to see what those objectives are. Have an accountability framework in place for us to be able to meet, say for example via a monthly operational review framework, for us to keep track of what we're doing around those performance indicators, whether they're national standards or business plan orientated. Ensure that we know that we're monitoring them frequently, and so too ensuring that that monthly conversation is connected to an annual performance conversation, so that what we're asking people to do in an annual cycle is consistent and connected to what we're doing on a monthly and day-to-day basis. So I think it's one thing to have those frameworks in place, but we also spend significant time working with the leaders on how to execute those accountability frameworks or processes that need to be put in place. So absolutely, accountability and leadership would be key in determining whether or not an organisation is going to meet the objectives, whether they're internal or external. In Asia, we see the similar situation when they're looking at Joint Commission International certification, or whether they're going through magnet certification. Objective measurement and holding people accountable to that so they can achieve those certifications is key, and it certainly is a challenge we see in healthcare today.
And I think from what I've read is that accountability is throughout the whole of organisation. We're not just talking about managers, we're going right down to all levels of the organisation, from the ward up to the CEO.
Absolutely, and I'm seeing with a lot of organisations that I've have the pleasure of working with, is they're going right down to ensure that happens. We're looking at ensuring they've got the right position descriptions in place, ensuring that when they recruit, they're recruiting for staff that will help them meet those objectives. So it is definitely a top to bottom view that an organisation's looking at. And the challenges today are so much more than what they were experiencing 10 years ago, and we're just getting more adept at being able to meet those challenges.